So I've always been interested in medicine, especially as a kid. I always grew up very interested in biology and the sciences. And as I advanced in my career, I really took a penchant into helping people and figuring out how to make a career with that, which is how I end up in medicine, which I hope I can make a great impact in people's lives. I'm a pulmonologist, so I specialize in the lungs, which I've always been fascinated with, especially after the COVID pandemic. It really showed how just vital the pulmonologists were to the health and just how important the lungs really are. So I would say that I like to make sure that I'm in a partnership with my patients. I like to hope that my patients feel like they're heard. And that we can approach what's going on as a team together. I really hope that when my patients leave my office, they feel like a sense of ease. At least, they may or may not feel better. Hopefully I can make them feel better with whatever treatment plan or regimen that we instill. But I really like to hope that the patients, and my patients specifically, feel at ease. They feel like they've been heard, they've been listened to, and that they know that there's somebody there who's going to really look out for them and figure out what the best next step for your health would be. So probably the most rewarding thing about being a pulmonologist as well as an ICU specialist is when I get patients who actually have a significant turnaround, whether that be in the ICU, when they come off the ventilator, they feel like they can breathe, or even just a simple asthmatic who really didn't know that they were asthmatic until we tried some medications, and they come back in a couple of months and they say, Doc, you really made a big difference. I can breathe. I can do all the things that I wasn't able to over the last few months. So that really is the most rewarding thing for me.